right.
Hi, so today we're going to be talking about stroke and in particular the sequelae of stroke. But first, let's just talk about the two types of strokes, ischemic and hemorrhagic. Could you explain those to us for a little bit?
Yeah, absolutely. So there are two types of strokes. The first type is we call thrombosis, which basically means one of the blood vessels or one or more of the blood vessels in the brain were blocked. And so, it caused the stroke. And the second type is hemorrhage. Basically, that means bleeding. Bleeding that is caused by rupture of the blood vessels in the brain. So there are two types.
And we make the diagnosis, mostly that's done in the hospitals, based on CT images of the brain. After they come out of the hospital, how does TCM treat?
Okay. Basically, the patients, if they came to us right after the stroke, we always send them to the hospital. And, mostly through CT scans, imaging. So the hospital will be able to tell the root cause of the stroke, whether that is because of the blockage or bleeding, because the treatment can be very different. And so some of them may need to do surgery, especially the bleeding type. If there is a blockage, the patients, when they are released from the hospital, they will probably be given a lot of anticoagulation drugs, which means to prevent blood clots from forming, etc. So, then we come in after the patients are being released. So we come in at the recovery phase. So so basically what we do is we use mostly acupuncture, sometimes using herbs too, but mostly acupuncture to help them regain their muscle strength. And also recover the mobility if possible, and some of the functions that are being affected by the stroke, because most of the symptoms, the most common symptoms from stroke is called hemiplegia. Basically, half of the patient's body are probably paralyzed. But then also there some internal organs can be affected at the same time. Like some patients will have incontinence, which basically means they cannot control their urine or urination anymore. So we come in, depends on which part of the body are being affected, we help the recovery. And the most, I will say the most common treatments or effective treatments are the scalp acupuncture. So needles go onto the head. And as many people scared, and the needles will not go into your brain because there is a scalp protecting your brain. So you actually go, on the surface. And that was invented by Dr. Zhao Shenfa in the 70s, and now is a WHO standard treatment for acupuncture to treat stroke. That's what we do. Yeah.
What is the prognosis, with treatment with TCM modalities? What's your result that you really see?
Right. Actually, we see a whole range of results. I mean, prognosis can be very different for each patient. First of all, it depends on how severe the problem is, and also when they come in. So let's say we have seen patients, they come in like immediately within 72 hours. That's, maybe it's hard to do in the US, but, in China, probably they can do it because patients will be within the same hospital that has TCM and Western medicine at the same time. So, so there is a window. When I learned, I was taught there is maybe a 72-hour window. So patients, if they can, get treatment as soon as possible, as soon as they are being released from the surgeons, and then they can start recovery, and the early the better. And I have also seen patients they come in. One of my patient came in like 2 years after the stroke because she really didn't know she might be able to get help from the acupuncture. And unfortunately, I didn't see a very good response for our treatment. So that is also possible. So it depends on the severeness of the problem and also the timing. So yeah, I have seen, some people with, mild stroke, so they can still walk. They're not like paralyzed, but they may not be able to walk properly. Some mild cases I have treated just after a few treatments. I think the patient can walk a straight line, and also be able to control her tongue better, so she can speak better. When she just came in, she was not able to do, those actions, but those are good results, and some of the good results, some of the, not very good results. There's a whole spectrum of the prognosis that we have seen. Well, come to the question that you asked me about herbs, what modality do we use? We use herbs too, but that is why, one of the reasons why we have to have the correct diagnosis, because if it's a bleeding versus blockage, the treatment can be very different. It should be opposite, because one, you need to move the blood, the other one is you need to leave it. Just don't do anything, because we have a whole bunch of herbs that can actually invigorate blood, remove stasis, and those, if in the hemorrhage case, that can cause more bleeding. There's a risk for doing that. But also, having said that, for the patients, they actually have the thrombosis type of stroke, they probably will be given a lot of anticoagulation drugs that is like high dosage of Coumadin or something like that. And then in that case, we also will not give them herbs, because you can also cause too much blood moving herbs plus drugs can cause bleeding as well. So from blockage to bleeding is possible if you use the wrong herbs.
Right.
So, yeah.
Okay.